Okay, so I wanted to talk about um, going into surgery. I know I've talked about my VNS surgery before, but I wanted to talk about what led up to it and what I was feeling and what the surgery re- what the surgery afterwards felt like and why it didn't work for me. So it was April 6th on my birthday, and we went to the neurology center at UMC in Jackson. Yeah, and so they had just cut the program for the VNS surgery. Now, I had been looking forward to this surgery for a long time, and I know that sounds weird. You're like, wait, you looked forward to a surgery? Yes. I loved having surgeries, and I know that sounds so stupid, but I had a surgery when I was 9, and it was basically like Christmas. I think I was in the hospital 2 nights. People would bring me food and presents. This is when you're 9. Okay. Now, this is supposed to be an out of patient surgery. For me, when it comes to like my health and my well being, I get kind of bossy. I'm like, no, I'm staying the night in the hospital because I've had bad experiences. But that's okay. I am still like, oh, got something on my hand. Sorry. I am still like, surgeries don't make me nervous. It's like, okay, chill. They're gonna lay me down and cut me open, and it's fine. Everything's cool. So they said, um, we cut the program of the VNS surgery, plus we don't really think it's gonna help you. And I was like, but I've heard so many good things about it. And the surgeon who was doing surgeries said, yes, it is, but really just don't think it will help you. Well, being the driven person I was, did not listen to my doctor at the time, or the surgeon. Um, I found an E ENT. Well, actually, he found me, and he was like, "Listen, I've performed the surgeries a couple of times. You'll be like my third person. If you're comfortable being like the third person to perform the surgery on, then it's gonna be great." And I was like, "Yes." And so I just thought it was God opening a door, right? It seemed hopeless. And so I met with him. He did everything, made sure it was good. He said, "Oh, yeah, you're a perfect candidate. We will perform the surgery on such and such date." Um, I want to say it was May, um, but I'm not positive. Okay, so I was currently dating someone at the time of my first ENS surgery, and we were both excited. He was great, and we decided that we were going to celebrate. And he was there at the hospital with me, along with my pastor. And I then got slightly nervous, like once I got to the hospital, because I didn't realize the magnitude of it. It's like when I was 9, I was taken to this room where they put you to sleep, and they've got all these toys, and like you get a stuffed animal, and then um, everything's good. So you get a stuffed animal, and then you wake up, and like your room. For adults, it's different. So if you're an adult and you've had surgery, you've probably had this happen. So they take you back to prep you, which I was cool with. I mean, I was so chill. I, I really wasn't nervous at all until they wheeled me into the operation room to put me to sleep, and I saw those knives. But I was kind of, the medicine they gave me, um, in the uh, room to prep me, like, put on a gown, and they give me a drip. This makes you really loopy and everything, so you're like totally calm. Um, I was waiting for them to come and give me, like, put me to sleep and then take me in there. And that's not what happened. They just wheeled me in there, and I was like, why am I not asleep? And they said, well, you're going to be put to sleep once you get in the surgery room or wherever. And I was like, really? And I remember the doctor looking, like, at me and going, okay, now count to 10. But before that happened, I got having some seizures. I got a glimpse of the tools they were going to be using. Now, they'd pumped my system with, like, this sleeping medicine. So I was like, is that what you're going to use on me? And he's like, you're not supposed to look to your left or your right. You're just supposed to keep looking at me. And I was like, those are the like, I was just so I don't know how to explain it. It's like, in my mind, I was a little freaked out, but I was like, eh. And so then they gave me the mask. When you're a kid, they ask you to say the not colors, the smells, right? And then when you're an adult, you just count backwards from 10. And so I was out by like 9. I was like 10, 9, and like I was out. And so then they did the surgery, and I woke up in a room where there were other patients, and I was like, why is everybody here? And I was very hot to the touch, like super hot. I was sweating, and they were taking my temperature, taking my blood pressure, all that. They had me sitting up, and anesthesia makes me throw up. So I'd come out of it, and I was touching my sore area, and they kept saying, don't touch it, don't touch it. And I was like, but there's something in me. And they were like, yeah, we just gave you surgery. But I was just still coming off of it, off the medicine. And so they offered me Sprite or water because I was really thirsty. And I said, Sprite? I never get Sprite. And so they gave me Sprite. And I was like, I'm going to throw up. And they were like, no, you're not. You're fine. I said, no, I'm going to throw up. And I threw up, like, on the sheets because they didn't give me a bowl or anything. I just, like, threw up. And I wasn't upset or anything. I just was like, oh, look at that. And so they were like, oh, now I got to change the sheets. Well, if they'd listened to me. So they did. They changed the sheets and gave me a new gown and then gave me some water. And then I fell asleep. And then once I woke back up, they rolled me to my own personal room. That was going to be the room I spent the night in. And the people who stayed there with me, my mom, my pastor, and my boyfriend at the time, they all saw me, and I was convinced I had a fever because I was like just hot and sweaty. And so I was like, I have 105-degree fever. My mom, of course, freaked out. She was like, what? And then she felt my skin, and I was hot to the touch. And the doctor's like, no. She has a 98.5 fever. And when the nurse walked away, I grabbed Mom, and I was like, no, I have 105-degree fever. They're just lying. And she's like, Kaylin, I think you're fine. So went in the room, fell asleep. Lots of people came to visit. It was good. And then they turned the device on, and recovery stunk. Okay? So the actual surgery part, I wasn't nervous about. I was like, whatever. They're going to put something inside my, chest. It's fine. The VNS is going to work. I was so pumped, so excited. I still have a video of me that morning. And I'm like, I'm going to have surgery. And I was weird. I was that weird kid, okay? And then they gave me pain meds. They sent me home the next day. And I really didn't want to go home the next day because I didn't feel that great. And they're like, oh, these pain meds will keep you from hurting. Lies. Okay, I'm not here to discredit the VNS, but I am here to tell you, if you have it, and are sent home with just some pain pills that you only get to take every 6 hours or 4 or 6 hours, it's painful, okay? Even with the meds. It feels like someone's stabbing you in the chest. And so I got home and I was excited because, I wasn't going to have to do anything. We're just going to get to chill, watch movies, read books. I couldn't enjoy any of that because I was like, ow. And so I just tried to sleep off the pain and then just take my medicine when they let me. And so, following up, they took the stitches out, and it didn't really hurt. It just felt weird, and then I passed out. And I woke back up, and they were like, "Hey, you okay? You okay?" And I was like, "Yeah, I think so." But he cut a little too deep, and it changed my vocal cords. Okay, the VNS will most likely change your vocal cords when it's going off, but for me, I literally, like, even when it wasn't turned on, was living with, gosh, I forgot where it was. Okay, so living with pain and my voice didn't sound the same. It sounded really hoarse, even when it wasn't turned on, and my voice was really quiet. If you ever met me, I'm a very loud, boisterous, just human being. When they turned it on, there's this video, and you can see my veins like just start getting really big, and they started me off really low, and they never got me to the therapeutic level or whatever. They never got me up there because it just was hurting too bad. So I have it turned off completely, and even with it turned off completely, it still hurt. So I signed up for removal surgery. Now my doctor was like, "You understand, if you get it removed, you can't have it ever implanted again." And I was like, "Yes, but I want it taken out. I just want the pain gone." So removal surgery, same thing, same process, and I again threw up. I always lost weight after these surgeries. I think everyone loses weight after surgery. And so I finally was able to completely heal, and my voice is still not the same. It dropped like 2 octaves or something, I don't know, 2 decimals. It just dropped. I still feel in my neck this so tender to touch, and when I talk, I can still feel that something isn't right. But if I don't think about it, like right now I'm thinking about like, oh, okay, yeah, that's how it feels in my throat, that's what's going on. But then, like, if I'm not thinking about it, kind of like blinking your eyes, you do it without thinking about it, but then when you start thinking about it, you realize you're blinking your eyes. Okay, same thing with breathing. You breathe without thinking about it, but then if you start thinking about breathing, you're like, oh, okay, control my breathing. That's how it is with my throat. So I don't notice the fact that I'm swallowing differently and that it feels kind of funny unless I start thinking about it. And then I don't really feel this bothering me unless I'm for some reason like hit it, and then suddenly I'm like, oh yeah, that hurts all the time. But I have numbing cream that I put on my neck and my scars, so this part of my body, like this little strip right here, is pretty much numb to the touch. So yes, that's my VNS story. I would suggest listening to your doctor because they know your brain, what's going on, and not doing what I did. I just really wanted it because I felt like I'd run out of options. I felt like there was nothing left. I was seeing a neurologist who was basically just upping and upping my meds. I didn't have an epileptologist at the time. Now I do. Dr. Mulhofer, he's great. But at the time, I didn't have one, and so I was just like, so we're just going to keep upping my meds, and then I become drug resistant, and then you just keep upping them and drug resistant. Like, there's gotta be another answer. So I went for the surgery, and it didn't work out quite right. So now I live with the scars, and I'm fine with it. People are like, oh, I'm so sorry, you must be so self-conscious. And I'm like, honestly, I don't even know they're there. Like, unless someone points them out and goes, what happened to your neck? And then I get to tell my story, and I'm like, yo, someone cut my neck, and I'm okay, and I lived. I don't say it like that. I tell them my story in short, like below a minute. I'm like, well, I have seizures, and they put a device in me that's kind of like a heart thing. It's a little device, and it was supposed to help my brain, but it didn't, so I got it taken out. God was there for me. God bless you, and then walk away. I don't know. That's just an example. So, anyway, that's my surgery story. Yeah, I'm the weird person who actually likes surgeries, but then doesn't like the healing process. I think I just like the attention that the doctors give me. They're just so nice. They're like, yeah, you want some coffee? You want some water? And they just treat you so good when you're in the hospital. But then once you get home, it's like, wait, I need a pain pill. And, yeah, recovery is no fun. Speaking of seizures, etc., it is time to go take my pills. Because I had probably about 10 seizures in that video that you might not have caught, or you might have caught. I'll have to rewatch the video and be like, oh, there's one. Because sometimes I can't even catch them. Like, they're getting shorter, which is a good sign. It's a very good sign. So, just have to stay on top of taking my medicine, and everything is good. Prayers and support appreciated. Stay safe out there. Love you guys.